Apologies for that start. So we now have a microphone. So welcome everybody. So my name is Peter Matheson. I'm the principal of the University of Edinburgh, and it's my great pleasure to be the first to issue a few words of welcome, particularly to our guest of honor, Dr. Tedros Adhanom Ghebreyesus, the Director General of the World Health Organization, from whom you'll be hearing a little bit later on. So welcome to Dr. Tedros. Welcome also to the Right Honourable Ian Murray, MP, Secretary of State for Scotland, and to Marie Todd, MSP, Minister for Drug and Alcohol Policy and Sport, representing respectively the Westminster Government and the Holyrood Government. So it's great to have both governments here. The Usher building, the new home of the Usher Institute, in which we're all present today here at the Edinburgh BioQuarter, is a symbol of many things for the University of Edinburgh. It's a symbol of the mission of the university to contribute to global issues and to global solutions, to multidisciplinarity, bringing together different disciplines into a co-located environment where they can interact effectively with each other and work together to solve challenging problems. We will hear a bit more about the building itself and the work that goes on in it in the formal opening ceremony, which is to come a little bit later on. We are in a mood of celebration at the University of Edinburgh, particularly with the news of last week of the funding of the UK's national supercomputer, which the aforementioned Ian Murray played a major role in helping us to secure via the Westminster Government's comprehensive spending review very recently. So that's another vote of confidence, I think, in the University of Edinburgh's ability to work with data, to be trusted with data, and that underpins so much of the work of the Usher Institute. So that infrastructure will help to support cutting-edge research, not just in Edinburgh, but over the whole of the UK, into things like personalised medical treatments, making air travel more sustainable, modelling climate change, and all that kind of activity, which is relevant to all of us and to our futures. The day has started here with a fantastic showcase exhibition all around the Usher building. I hope you've had a chance to walk around and meet some of the people working here and hear from some of especially the young people, the students and the young researchers, so passionate about their work and about their fields and about the areas in which they're seeking to make contributions. All of those people come together here in the Usher building with the shared purpose of transforming health and care through data-driven innovation. So that's the mission of the place. Now, the first part of the events today is to introduce and award the Edinburgh Prize for Global Health Impact. And to do that, my colleague, Professor David Argyll, who's head of the College of Medicine and Veterinary Medicine here at the University of Edinburgh, is going to introduce the prize. David, over to you.
Thank you very much, Peter. As Peter said, I'm the head of College for Medicine and Veterinary Medicine, which is a huge privilege when you see the amount of work that's going on here. It really is incredible. I'm delighted to welcome you to the Usher building today for this special event. But for this first part of the official ceremony, I have the role of presenting the Edinburgh Prize for Global Health Impact. This is a new prize established in 2024 and is a sister award to a historic Cameron Prize for Therapeutics, which was founded at this university in 1878. Since this time, the Cameron Prize has been awarded to 78 scientists whose work has led to major therapeutic innovations. And many of them have gone on to win the Nobel Prize, by the way, so just no pressure in all of this. The new prize honours the collective achievements of departments, institutions, or multidisciplinary groups whose work has led to major measurable improvements in global health outcomes. The prize is to be awarded biennially to a group whose contributions to a global health issue, whether through innovation, implementation, or systems leadership, have resulted in the demonstrable population-level impact. In establishing this award, the University of Edinburgh acknowledges the collaborative nature of modern scientific and public health endeavour, recognising that many of the world's greatest advances in health arise from the sustained work of interdisciplinary teams and institutional partnerships. We are delighted to be awarding the 2024 Edinburgh Prize for Global Health Impact to the World Health Organization's expanded programme on immunisation for their work on facilitating childhood vaccination, thereby saving millions of lives. The Expanded Programme on Immunisation, or EPI, was launched in 1974 to ensure that all children in all countries benefited from life-saving vaccines. This programme has evolved into what is now commonly known as the Essential Programme on Immunisation. Today, every country in the world has a national immunisation programme, and vaccines are viewed as one of the safest, most effective and successful public health interventions to prevent deaths and improve lives. Since the initial focus on protection against 6 childhood vaccine preventable diseases over 4 decades ago, the addition of new vaccines has increased the breadth of protection provided by immunisation to include vaccinations for protected and older children, adolescents and adults. There are now 13 vaccines recommended by WHO for the EPI programme. Committed to its goal of universal access to all relevant vaccines for all at risk, EPI continues to work in synergy with other public health programmes to control infectious disease and achieve better health for all populations everywhere. 2024 marked 50 years since the expanded programme on immunisation was initiated. And today we're honoured to be joined by Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, who will accept the prize on behalf of EPI. I would like now to invite Dr. Tedros to collect the Edinburgh Prize for Global Health Impact and perhaps say a few words about the work. They'll edit me out afterwards. Thank you.
Thank you. Very full house, huh? The Right Honourable Secretary of State for Scotland, Ian Mary, Honourable Minister Mary Todd, Vice Chancellor and Principal Professor Sir Peter Mathieson, and Vice Principal Professor David Argyle, Director of the Usher Institute, Professor Cathy Sadlow, the Usher family, very honored to meet you, connection of more than 100 years, and esteemed members of the University of Edinburgh community, dear colleagues and friends. Good morning, and my thanks to Professor Argyle for that very kind introduction. I think I'm saying the name well, eh? Because I was... And my thanks also to everyone at the university for your welcome and hospitality this morning. On behalf of my colleagues at the World Health Organization, past and present, I'm honored and humbled to accept the inaugural Edinburgh Prize for Global Health Impact. The first is always remembered, so I'm glad. WHO has the first prize. It's also an honor for me to join as we open the new Usher building here at the University of Edinburgh. I'm very happy to be back at this great university, of which I am a proud honorary alumni. As you all know, with 442 years of history, the University of Edinburgh was an academic training ground for notable leaders in science, politics, and many other fields, including Charles Darwin, Alexander Graham Bell, and my good friend, former Prime Minister Gordon Brown. The university also has a distinguished history of medical innovation, from James Young Simpson's development of chloroform anesthesia to Joseph Lister's introduction of antiseptic techniques in the 19th century. More recently was the development of the first genetically engineered vaccine against hepatitis B. These days, among its many accomplishments, Edinburgh is doing cutting-edge vaccine research. including in the areas of chronic inflammatory diseases, the innate immune system, and immune homeostasis and autoimmunity. So it's quite appropriate and a particular honor that the first Edinburgh Prize for Global Health Impact recognize WHO's work to provide children across the world access to life-saving vaccinations. Vaccines are among the most powerful innovations in history. Thanks to vaccines, smallpox has been eradicated and polio is on the brink. Thanks to vaccines, once feared and deadly diseases like measles and Ebola are now preventable. And with new vaccines against malaria and cervical cancer, we can save more lives than ever. Vaccines help individuals, families, communities, economies, and nations to thrive. Every dollar invested in vaccines delivers a return of $54 in healthier children who are to learn and earn and become the scientists, teachers, politicians, artists, and innovators of the future. 50 years ago, in 1974, WHO established a groundbreaking initiative to dramatically expand access to vaccines. The expanded program on immunization known as EPI. By the way, when Professor Argyle said about the Nobel, I actually wonder why WHO was not provided with one. Even smallpox eradication could be enough, I think, to get that. So I'm taking it on a serious note now. Exactly. At the time, and this will be a good omen, I think, the prize from from Edinburgh. The success of EPI is due to health workers in every country who deliver vaccines in communities, sometimes at greater risk. Some have even lost their lives vaccinating against polio in Afghanistan and Pakistan, or in other outbreaks in insecure areas. EPI is also a foundation for pandemic and emergency prevention, preparedness, and response. The EPI program was the basis for the COVID vaccine response in many countries and is the program that responds to outbreaks of other vaccine preventable diseases day in and day out. Thanks to EPI, an infant born today is 40% more likely to survive to their first birthday than they were 50 years ago. Since 1974, EPI has helped to save an estimated 154 million lives from diseases like measles, tetanus, diphtheria, and pneumonia. And since 2000, under 5 mortality has dropped by more than half, thanks largely to the power of vaccines. By the way, 2000 was the birth of Gavi as well, the Gavi Alliance. A large part of that success has been thanks to the Gavi Alliance, a revolutionary partnership between WHO, UNICEF, the World Bank, civil society, industry, academy, and more. Just yesterday, I was in Brussels for Gavi's replenishment event. As you're all aware, it came at a difficult time in global health, with drastic cuts in aid, which come after disruptions to immunizations programs in many countries due to COVID-19 pandemic and misinformation about vaccine safety. As a result, all killers like measles, diphtheria are resurging. So I was very encouraged yesterday that donors pledged more than $9 billion to support Gavi's work over the next 5 years. We're deeply grateful, especially to the United Kingdom, which has been one of the most steadfast supporters of both WHO and Gavi, and with its contribution yesterday, from a single donor, actually the largest contribution. As you are all aware, WHO has also been affected by cuts in aid by the United States and other countries, which are reducing official development assistance to fund increased defense spending, a sad sign of the times. For several years, we have been transforming the organization to make it more effective and efficient. We have reduced our costs and implemented several measures to make our funding more sustainable and secure in the long term. Even so, we unfortunately have no choice but to say goodbye to a significant number of dedicated and talented colleagues. I'm very conscious of the impact on them, their careers, and their families. At the same time, in every crisis, there is an opportunity. And I'm confident that WHO will emerge from this situation stronger, sharper, and more focused on our core mandate, more empowered to serve nations and people of the world. But of course, WHO is just one small part of a much bigger picture. Around the world, the dramatic reductions in aid that I mentioned are having severe impacts on health services in many countries, especially developing countries. We see disruptions affecting millions of people who are missing out on life-saving services and medicines, including vaccines. Health facilities are being forced to close. Supply chains and information systems are disrupted, and out-of-pocket health spending is on the rise. WHO is supporting countries to navigate this crisis and sustain health services. But again, in the crisis lies an opportunity. Many leaders and ministers have told me that this crisis can also help them to leave behind the era of aid dependency and move toward sustainable self-reliance by mobilizing domestic resources. On the vaccine front, WHO is supporting countries and regions to increase local vaccine production, especially in Africa. One of the lessons of the COVID-19 pandemic was that production of vaccines and other tools was concentrated in too few countries. With the launch of the African Vaccine Manufacturing Accelerator, WHO is supporting the African Union to reach its target of producing 60% of the continent's vaccines by 2040. In 2021, WHO established the mRNA Technology Transfer Program, which is now sharing technology from its base in South Africa with 15 partner countries globally. In 2023, we also established the WHO Biomanufacturing Workforce Training Initiative, including Global Training Hub in the Republic of Korea. WHO also supports access to vaccines through our pre-qualification program and the advice of the WHO Strategic Advisory Group of Experts on Immunization. We support strengthening of regulatory systems. Rwanda, Botswana, and Ghana are all on their way to the top level of regulatory robustness, for example. And we're also supporting stronger national and continental institutions, including the African Medicines Agency and the Africa CDC, because strengthening the continental institutions could support the continent. At the World Health Assembly last month, the nations of the world made history by adopting the WHO pandemic agreement. And having a pandemic agreement in the middle of all this geopolitical tension, actually a sign that multilateralism is alive and well. So good news in the middle of all this crisis. And the key element of this agreement, one of the key elements in this agreement is an agreement between nations to ensure equitable access to vaccines in the next pandemic, because that was one of the major challenges during COVID. And the rapid development of safe and effective vaccines against COVID-19 was a triumph of science. But inequitable access to those vaccines was a collective global failure that cost lives. WHO's member states have recognized that in a world divided by politics and ideology, diseases do not recognize borders. They don't recognize the maps we draw. Shared threats need a shared response. And that means vaccine equity, not for some, but for all. WHO was founded in 1948 as the world emerged from devastation of the Second World War. Like the United Nations, of which we are part, WHO was born of the recognition that the only alternative to global conflict was global cooperation. Our constitution was the first instrument of international law to affirm that the highest attainable standard of health is a fundamental right for all people without distinction, a fundamental human right, not a privilege for some or for most, but it's a right for all. Thank you once again for this great honor, which I accept on behalf of our organization, WHO, on behalf of my colleagues, past and present. And thank you for your commitment to promoting, providing, and protecting health for all. And I thank you. Thank you so much. Thank you.
So thank you very much to Dr. Tedros. Thank you on behalf of the University of Edinburgh and everybody here, but thank you also on behalf of the children of the world, my children and my grandchildren and all the other people's children and grandchildren. Those statistics that we heard are really staggering, absolutely incredible. How can anybody promote the public view that vaccines do more harm than good? I mean, we know they do harm, but the benefit that they do is quite extraordinary. So thank you very much for highlighting that for us and the work of the World Health Organization. And what a fitting organization to receive the first Edinburgh Global Health Impact Award. I hope the Nobel Committee is paying attention, and we'll look forward to them following in Edinburgh's footsteps. That would be nice. So now we're going to move towards the official opening of the Usher building, and it's my pleasure to tell you a little bit more about the building and remind you of some of the history of the Usher Institute, and then look forward to the future opportunities that working in this fabulous building and with all of its collaborating organizations will bring. So the building, many of you will be aware, was funded in large part through the Edinburgh and South East Scotland City Region Deal, to give it its full name. We tend to abbreviate it to City Deal, which is a shortened form. This was an agreement with both governments. It was led by the majority of the funding from the UK government, but with major contributions from the Scottish government, and a good example of a devolved government working very effectively with the parent government in Westminster. £49.2 million of capital funding between the two governments went into this building, supplemented with funds from the University of Edinburgh and additional generous support from the Wolfson Foundation. So we're extremely grateful to everybody that was involved in allocating and securing that funding for what is already proving to be a really crucial anchor here in the Edinburgh BioQuarter. Those of you that know Edinburgh will know that over there is Edinburgh's major hospital. We also have research institutes here on site. We now have the Usher Institute here, and we, together with the NHS, the Scottish Government, the Edinburgh City Council, and Scottish Enterprise, have great plans for the rest of this site. So this will be a site that I think will grow and will become more and more significant over the next years and decades, but is already making major contributions to healthcare, both current healthcare and future healthcare. So some of you will have found out on the tour this morning, the Usher Building brings together more than 900 researchers, health and care providers, and industry leaders working together to address urgent challenges in health and social care. And I'm pleased to see so many people from this community here in the room today. No doubt more people are joining us online, and we should greet those people that are joining us online that weren't able to be here in person. As a university, we greatly value being part of the City Region Deal. It's important to us to acknowledge our civic roots. The University of Edinburgh was founded by the people of the town, and it's the 6th oldest university in the English-speaking world, but the 5 that are older than us were all founded in some shape or form by the church. So this was actually the original civic university. And that civic origin was very important in 1583 when we were founded, and it's very important in 2025 as we look to the future. We have this opportunity to make a real difference locally as well as globally, and the two things are not in competition. We can be relevant locally and globally, and we aim to do both. The regional investment of the City deal is helping to build the local economy. For example, we're offering training in data science to empower local workforces, making them able to meet the needs of innovative and forward-thinking companies and initiatives locating here in Edinburgh and South East Scotland, growing the reputation of Edinburgh as the data capital of Europe. This is one of the strap lines of the data-driven innovation part of the project, and we already got many reasons for believing that that's not an aspiration that can't be delivered. The Usher building was built by principal contractor McLaughlin and Harvey, who along with their various subcontractors met a very challenging brief that we gave them for community benefits built into the construction contract. For example, 40% of local labour was procured within 20 miles of the site. 56% of all project spend was within 20 miles of the site. And there were 78 apprentices supported on the project. Architects Hassel worked tirelessly with an engaged Usher user group, responding to ideas and requests for how the spaces would work to bring us into a more collaborative and interactive future. And I think you can all appreciate the fruits of the design as you've spent some time looking around the building, and for those of you that are already working here. It's great to see representatives from both of these companies, as well as others involved in the build here today. It's a building that we're especially pleased to be able to say is the first new University of Edinburgh building to have absolutely no gas supply. It's heated solely through air source heat pumps, an example of our commitment to sustainability and thinking ahead to the future. And as I hope we're now all aware, the building is home to the Usher Institute, which first came into existence in 1898 when Sir John Usher, Baronet of Norton and Wells, gave money to the university for the first chair of public health in the world, and then later gave money to build a physical home for the Usher Institute on Warrender Park Road. We're particularly delighted to welcome descendants of Sir John, Richard and Stuart Usher, here today, representing the family, and as Dr. Tedros says, representing more than 100 years of the Usher name being associated with public health research here at the University of Edinburgh. We're also delighted to welcome Richard and William Brotherston, who are the sons of Sir John Brotherston, a former holder of the Bruce and John Usher Chair of Public Health until 1983. Emeritus Professor Raj Bhopal is also here, another previous holder of this prestigious chair, and we're grateful to Raj and to his wife Roma for their donation towards education and outreach here at the Usher Institute. The current holder of the Bruce and John Usher Chair of Public Health will be no stranger to most of you, the wonderful Professor Linda Bold, and I'd like to take a moment to thank her and the many other members of the Usher Institute on behalf of us all for their tireless work during the COVID-19 pandemic and the ongoing work to support health and well-being in so many dimensions. Linda and Debbie Sridhar and others became very significant public figures during the pandemic as they advised governments and as they advised the public how to respond to the pandemic. And it was a great illustration of the power of the University of Edinburgh locally and globally. And we were very grateful to them at the time, and I'm very grateful to them now. The Usher Institute brings together expertise in social science, artificial intelligence, machine learning, clinicians, engineers, public health professionals, and more in a transdisciplinary environment, building a community with a shared purpose of transforming health and care for people locally and globally. There's a strong commitment to public involvement, asking the public to help guide and shape the future as we push forward boundaries with new technologies and approaches. And I'm pleased that there are many representatives of some of the public organizations who are actively involved in the work here in the room here today. Thank you also for all that you do and will do in the future. Whilst there's always more that can and will be done, I genuinely believe that the Usher Institute represents the values of working together with partners to develop equitable and sustainable relationships with communities locally and globally. I think I've said locally and globally enough times now for you to realize that that's really important. I look forward to finding out what further innovative solutions to health and care challenges come from this building and its ecosystem in the years to come. But with that, I'd like to introduce the aforementioned representative of the UK government, the Right Honourable Ian Murray MP, Secretary of State for Scotland, a local Edinburgh MP, but also now the Secretary of State for the whole country in Westminster. Ian, welcome to the Usher Institute and thank you for joining us.
Good morning, Director General, Minister, Vice-Chancellor, professors, ladies and gentlemen. It's a great pleasure to be here today as we gather to celebrate a really significant milestone in the history of this institution, the official opening of the wonderful Usher Institute here at the University of Edinburgh. I'd like to pay an extended warm welcome to Dr. Tedros. Can I just say, Dr. Tedros, your Argyll is better than my Ghebreyesus. You did very well indeed. And it is a tremendous pleasure to share this platform with you. Your presence here adds great value to this occasion. It's a great privilege to be here with you. Congratulations on your award today. This work of the World Health Organization in vaccination has saved millions of lives, as you said, and those statistics, as the Vice-Chancellor said, in every part of the world are truly staggering. Every single one of those projected £146 million lives are a testament to the work that the World Health Organization does. I came into politics, and many of us came into public life to try and make a difference to people's lives. And changing one life, as we know, transforms that for them and their families. And your leadership at the World Health Organization and the impact that you make on a global scale with health inequalities transforms those lives. And at a time, of course, as we know, of global instability and insecurity, with the global consensus on vaccination and health being challenged, we all must redouble our efforts to make that case. And I'm delighted that we are the largest single contributor and donor to Gavi, and that shows our governments and countries' commitment to that worldwide programme. Now, as Secretary of State for Scotland and an Edinburgh University graduate, I feel a profound honour to be here today at this moment. And I know that Chris Murray, the Member of Parliament for Edinburgh East, is also here. We fight regularly about who is responsible in representing this site. I think we will agree to disagree that we will share it. But we are not just, of course, inaugurating this building today. We're signalling our commitment to a brighter future, one defined by health innovation, economic growth, and a dedication to improving lives of those across Scotland, the UK, and indeed the impact across the rest of the world. The Usher Institute at this BioQuarter isn't merely a physical presence. All of us in here today and this building embodies a collective ambition and vision for what we can achieve, and of course made possible by the collective investments of both governments, and indeed 48.5 million from the UK government. This institute will drive true collaboration, where world-leading academics, healthcare professionals, and industry leaders will come together to create solutions for the pressing health challenges that we face today, both in Scotland and, of course, beyond. Positioning Edinburgh University, again, as we always have done, firmly on the global map as a centre of world-class research, nurturing the talent of the future, fostering essential partnerships across key sectors, such as finance, technology, education, and, of course, life sciences. Now, I may be slightly biased, as this is the best university in the world, but we are backing that global position with the UK government's commitment, as the Vice-Chancellor has already said, to making this the UK Centre for Supercomputing with £750 million, and of course our new industrial strategy, which prioritises the high potential growth sectors for our economy, including life sciences, AI and tech, which will be driven by this university. We're driving further investment in our public services and creating high quality jobs for people here in Edinburgh and Scotland through these wonderful institutions. So I want to reiterate our unwavering support and commitment to the City deal. That's been a total of £1.5 billion of investment through the deals programme that we are dedicated to using to foster regional economic growth and bringing institutions, businesses and people together to drive the benefit from these investments. And as we reflect today on the opening of this Usher Institute building, I extend my heartfelt gratitude to all those who have worked diligently to bring this vision to fruition. Your commitment to advancing health research exemplifies the very best of collaboration and innovation. And without your leadership, these visions and these projects simply do not happen. So thank you to Professor Sudlow and her team here at the Institute in particular. The trailblazing work that's already happened is there for all to see and is changing lives as we stand here today. So looking forward, I'm genuinely excited about the groundbreaking work that will emerge from this remarkable institution. And together, let's harness the incredible resources to build a healthier, more equitable future for all of our citizens. So thank you so much for allowing me to share this with you today. It's a great privilege to spend it in the room with so many wonderful people. And let's continue this journey together to build that brighter future for many generations to come. Thank you very much indeed.
Thank you very much, Ian. And it's my pleasure now to introduce Marie Todd, MSP, who is the Minister for Drug and Alcohol Policy and Sport in the Scottish Government. Marie.
So thank you very much. It's an absolute honour to be here today to mark the official opening of the Usher building, an extraordinary new centre for life sciences and medical innovation, and a cornerstone of the Edinburgh and South East Scotland City Region Deals data-driven innovation programme. That doesn't trip off the tongue. In a country with a proud history of medical innovation, this building represents a forward-looking investment in health and social care, not just for Edinburgh and its surrounding region, but for Scotland and beyond. Supported through the Scottish Government's £300 million investment in Edinburgh and the South East Scotland City Region Deal. I'm just going to call it the City Region City Deal. The Usher Institute's new building is a fine example of what can be achieved when we combine world-class research, cutting-edge data science, and a shared commitment to making people healthier. This building will be a hub where researchers, clinicians, entrepreneurs, and communities all come together to harness the transformative power of data. It's already home to initiatives like Usher Connects, which recently brought over 100 delegates together to explore how housing affects children's health. An example of the Institute's mission to tackle real-world challenges through collaboration. Now, this is a place where innovation is not just encouraged, but it's embedded in the very fabric of the building. With the development of heart disease and mental health registries through the Data Loch service, to the delivery of over 20,000 training courses, the Usher Institute is equipping Scotland's NHS workforce with the skills and the insights that are needed to improve health outcomes in a data-driven world. The economic impact is just as impressive. So over 316 million in research income, 283 projects driving adoption of new technologies, and 49 new data-driven businesses launched. Beyond the numbers, this is making people's lives better, creating opportunities and transforming our future. Medical innovation has the power to change everything. With it, we'll detect disease earlier, personalise treatment, and deliver care more efficiently. But more importantly, it can give people longer, healthier, disease-free lives, more fulfilling lives. This building will contribute to that brighter future. Now, while I'm here, I am absolutely honoured to welcome Dr. Tedros to Scotland. Dr. Tedros has led the World Health Organization through an unprecedented period in its history. His compassionate, intelligent leadership is appreciated by those of us who recognise the rules-based international order as a keystone of progress. I want to congratulate him on his acceptance of the very first Edinburgh Prize for Global Impact, awarded to the World Health Organization's Essential Programme on Immunisation. I'm not sure how winners in the years to come can match the impact of that programme. Set up in the wake of the eradication of smallpox, the programme's delivered 50 years of life-saving vaccinations, particularly for children. It is, and it continues to be, an incredible achievement, and it's as relevant today as ever. The disruption of COVID and the avalanche of misinformation has caused a fall in vaccination rates around the world. And Scotland's rates, although they remain high, we cannot be complacent. Now, other than sanitation, no other public health intervention is as essential as vaccination. And it is for us as scientists, as health professionals, as public health administrators, to redouble our efforts and rebuild the trust that is so important in public health. Now, I have no doubt that you're equal to that task. And who knows, maybe one day this building will deliver something just as revolutionary and beneficial to human health as vaccines. Thank you.
Thank you very much, Marie. So now I'm going to invite Dr. Tedros to return to the, well, it's not a stage, but the area, because he's going to unveil the plaque for us. But Dr. Tedros, if you'd like to give us first any reflections you have on your visit to the Usher Institute and anything else that you'd like to bring to the attention of the audience.
I have
you
a
have a microphone. You don't need this high text.
Yeah. Yeah, thank you for saying my name properly. You know, it's like what David showed me to say his name properly. He divided it into two, Argyle. And mine, when people ask me, I say I do it the same way because it's two parts in my name, Gabriel, and the second part is Jesus. So Gabriel, Jesus means the servant of Jesus. Gabriel is servant. So Gabriel, if you take the first one, Gabriel, and then the second Jesus, it's easy to say it. So Gabriel Jesus was correct because in our language we call Jesus Jesus. Yeah. So you said it properly though. You don't need any explanation. And Right Honorable Ian Murray, the Honorable Mary Todd, Professors Mathieson, Sadlow, Argyle, the Usher family, dear colleagues and friends. I'm delighted to be with you today for the opening of the new Usher building. I offer my congratulations to the entire university community on the opening of this important new research facility. It brings together a number of innovative institutions, including the Usher Institute, a WHO collaborating center that works on population health research and training. And earlier this morning, I had the privilege, as many of you have seen, of taking a tour of this impressive new research hub. I was very impressed by the researchers and projects I showed today. They included work on inequality for disease and mental health, NHS waiting list, a very interesting one, inflammatory diseases, that reminded me of my own work in immunology in the lab, macrophages, the artificial intelligence, HIV stigma, cervical cancer screening, respiratory disease, pediatric pneumonia, and much more. And other pioneering health work in this new research complex includes artificial intelligence, diagnostic imaging, cancer genetics, and using population data to enhance prevention, diagnosis, and care delivery, and address health inequities. Of course, the patient safety and performance in surgery as well, which was very impressive. So there is, what I can say is just one, there is a great opportunity for WHO here. So although this building is new, its twin purposes, education and research, are not. And they have always been central to the mission of the university, just as they have always been central to improvements in health globally and to our work at WHO. We would welcome the opportunity to discuss with you how WHO could expand our partnership with the Usher Institute and the University of Edinburgh to leverage your expertise and experience for a healthier world for all. Because we work through institutions, and that's why we have a collaborating center here. And I saw a lot of opportunities today to even work closer and have more collaborating centers in the University of Edinburgh. That's what this building is for now. It's about collaboration. And that's what the work that we do at WHO is all about. And we share the same purpose. My thanks once again to the entire University of Edinburgh community for your work, your partnership, and your dedication to a healthier, safer, and fairer world. It's now my great honor to officially declare the Usher building open. You pull here,
Yeah.
the short one.
Yes. We'll pose for an official photograph. I
No,
guess.
what a great honor to be connected with the Usher Institute
Indeed.
and even the alumni of Edinburgh.
Thank you. Yeah.
Yeah, thank you. Thank you. Thank you for accepting me as part of the family.
Thank you very much, Dr. Tedros. And as Marie said, I think the bar has been set pretty high for the Global Impact Health Award. We'll see who follows in the next award winner. It's fantastic to have you here to lead the party to actually officially open the building. I think we're now going to have a vote of thanks from Professor Kathy Sudlow, the director of the Usher Institute.
Thank you very much. So proceedings are nearly over, but it's my absolute pleasure as the pretty new director of the Usher Institute to be able to offer a short vote of thanks. So I've actually been part of the university for many, many years, but out on secondment over the last 10 or 15 years or so, working on various national UK research programmes, including more recently being part of the UK's Institute for Health Data Science, Health Data Research UK, heading up a data science centre within that institute and latterly working as its chief scientist and doing some very interesting work mapping out the health data landscape across the UK and producing a report for UK government, which is having an interesting impact on the field across the UK, including new investment, which I very much hope will have an impact up here in Scotland. It's absolute privilege to be the new director of the Institute. I take very little credit for all of the wonderful work that you've heard about and seen in the showcase so far, although I have been involved in just a small amount of it. But it's a delight to be in this building, which is populated by people across a multitude of disciplines, across the college, across the university, but outreach not only across the region, but across the country of Scotland, across the whole of the UK, and indeed very important and I hope increasing global partnerships. I particularly want to thank Dr. Tedros Ghebreyesus for joining us here in Edinburgh this morning. It's been a real delight to meet you, to learn a bit more directly from you about some of the work that we're honouring you about today. And it's wonderful to know that you're keen to continue to work with us closely here in Edinburgh. And we look forward to closer collaborations with the WHO and across the world. I also want to thank colleagues from UK and Scottish Government, Ian Murray and Marie Todd. It's been wonderful to have you with us here today as well, representing UK and Scottish governments who played such a major role in providing investments through the City deal that have been a core enabler for this building coming into existence. It's also important to thank the Wolfson Foundation for their additional generous investment, and of course the Usher family, who were behind the original building that housed the Usher, the original Usher Public Health Centre over in Marchmont, that bears the name of this building. We also are lucky enough to have here a number of the members of the design and construction teams who are involved in putting this building up, notably Will Hartzog, I believe, from Hassel, the architects, and Steve Irvin from McLaughlin and Harvey, the principal contractors. So there was, and I again was not part of this, but I was aware of it going on through being aware of emails and all sorts of invitations to participate in consultation groups over many years. But there are members of the Usher community who've been very, very closely engaged with the design concept and the co-design and collaboration that went into putting this building into place, breathing life into it. All the design features that you will enjoy looking at today have been very much a collaborative endeavour. And it's really important, I think, to thank those who gave up a lot of their time, enthusiasm and commitment to make sure that this building works in the way that it does, with collaborative spaces and light and air, and all the things that you would expect. My colleague Andrew Morris used to talk about breathing the same air. That maybe became a slightly different concept during the pandemic, but that notion of people working together across disciplines in common spaces is so important for the bright sparks of ideas that come from crossing disciplines. From within the university as well, our colleagues in estates have done an absolutely amazing job in working hard over many years to bring this building project to life and to help everything get up and running. So we're very grateful to you for your efforts as well. I'm really looking forward to working in this space with excellent colleagues over the months and years ahead, and to continue to make those connections which have actually come from the creation of the building itself. And I also want to thank everyone who's worked very hard to make today such a success. So there are lots of people who've worked behind the scenes to put in place the showcase exhibitions that you've seen, to ensure that everything's happening like clockwork and on time. Lots of people who've put energy into putting up displays, talking about them, thinking about them over a prolonged period before putting them in place for today. I particularly want to highlight the Usher Institute's events manager, Laura Marshall, who's done an absolutely amazing job in pulling everything together, incredibly supported by the Usher Institute communications team led by Susan Buckingham, and indeed a brilliant collaboration with colleagues from across the university. Notably Rebecca Whitefield, who's been here today making sure that everything goes like clockwork, but I'm sure huge amounts of masterminding in the background as well. Fantastic colleagues in central stakeholder relations, the press office teams, and many more besides. So I really want to thank all of you now for joining this event today. Those both here in person, but also those who are joining us online. It's really brilliant to see everyone here today. You've got an opportunity after lunch and during the course of the afternoon to enjoy some of the stuff in the showcase, to enjoy the building. So please do take advantage of that and enjoy connecting with each other as well. Thank you very much to everybody. And very quickly, some housekeeping, which is just to ask if we can have the indulgence of some of us here at the front to leave the room first, because we've got a tight schedule, I believe, to follow after this. But for all of you, please do enjoy lunch and enjoy the building and enjoy the showcase. Thank you.